So, the three main theoretical approaches throughout the empathy-based literature is the experiential approach, the resiliency approach, and the fatigue etiological approach. So, the experiential approach focuses on symptomatic responses to exposure to client trauma, in which empathy-based stressors are comparable to PTSD symptoms and addressed through a clinical approach. The resiliency approach focuses on individual and organizational factors in which crisis workers are predisposed to empathy-based stress and addressed through an epidemiological approach that considers predictors and preventers of stressors. The fatigue etiological approach focuses on causes of empathy-based stress arising and worsening and addressed through observations of trajectories of stressors. And a couple of the gaps in the compassion fatigue research, in the empathy-based work research. There's a lack of measurement of the effect of crisis worker personality traits that include agreeableness, extroversions, introversions, neuroticism. So those, the quality of life survey does not really measure those, but the research seems to indicate that these may be areas that are important to consider, especially when working with a team, and especially with many of us who are drawn to this kind of work have our own healing, our own trauma healing, our own trauma narratives and stories and experiences. And so, when you're working with a team and you have some individuals that are sort of introverted and not as outgoing and not as, just differences in personalities, especially in workplaces that have a lot of social events and things like that. So sometimes, like, fundraising events, those kind of environments can be triggering to some. It can, when you're called upon to represent your organization, your empathy-based organization, and the work that you do in a setting that requires you to be more social than you're comfortable with. That's just an example. The lack of measurement of external factors in the crisis worker's personal life that impact level of empathy-based stress, that include balancing work and family, interpersonal functioning, intimacy, and relationship satisfaction. These are also areas that the quality of life survey doesn't specifically measure, but certainly worth conducting some more research on. It's difficult to do quantitative research on this, so it's more of a qualitative approach because everyone has such individual needs and demands in their personal life. So, having children, taking care of an elderly relative, having a relative with a disability, having your own health issues, and just balancing things in your personal life, your personal satisfaction, as well as the compassion satisfaction. Those are, not only are you trying to seek the increase compassion satisfaction at work, but you also want to have personal satisfaction in your life, because we are human, and this is why it's important to do this kind of work and to provide organizations with this kind of education. The consequences of not addressing concerning levels of compassion fatigue in the workplace. Obviously, a high employee turnover. People will just not last. They just won't be able to stay in an environment that isn't supportive. Decreased satisfaction in work and personal life, which is what I was just mentioning. Risk of mental health decline, and also a risk of physical health decline, because our bodies carry a lot of the emotions and some of the secondary traumatic stress that we experience. There's also a risk of organizational liability in ensuring the mental and physical wellness of crisis workers. If an employee has a mental breakdown or has suicidal ideations or is experiencing physical symptoms that resemble having a heart attack, those are things that we want to avoid. And that's why it's important to address compassion fatigue in the workplace.